Kevin Hart had a special, and I forget the reason. It was some kind of celebration for him, some kind of recognition that he had got. And we all know that he's a phenomenal comedian. But one of the things that I found interesting that there is a very, very popular and famous comedian who had a stroke. And then he was on Kevin's show and thought it would not be robbery if he got on the show. And he told some stroke jokes. And I saw him again not too long ago, and he really showing signs, obvious signs, speech-wise, physically, of what happens when one has a stroke. Well, I'm gonna begin this segment by saying stroke ain't no joke.
Oh,
Ain't no joke. So what we need to do, and what I thought would not be robbery, if we took the time to try to educate the community on not having one or what to do to prevent one and what some of the treatment options are. So I couldn't think of a better way to do it or better two people. I started to say persons, but we got Miss Denise Goins along with Dr. Matthew Smith on the show with us today. But because we're entering into a time where there's emphasis being put on stroke recognition, stroke diagnosis, and stroke prevention and stroke treatment, I thought that we would be doing ourselves and the community a favor by having this show. So this is a call to action. I'm your host, Alex Habersham, and I'm so proud and so happy to have two stroke experts who agree with me. This stroke ain't no joke. Who's going to impart information, to the community? Now, let me tell you what needs to happen. You all need to record this. You all need to save it. And if you can't find it, you all need to call me. Matter of fact, if you subscribe to my Facebook page, and my YouTube page, you can get it anytime. But this needs to be shared. This is my desire to get this information to the entire community because we all know how strokes change people's lives. So, as I said, we got Dr. Matthew Smith, who got two titles. You know what I'm saying? Titles so long I can't remember them all. So I'm gonna let him give his own title. Dr. Smith.
yes, my name is Dr. Matthew Smith. I am the Director of Neurology and the Director of Stroke at Atrium Health, Navicent.
So let's just come out the chute and just talk about strokes, and then we could approach it in any manner that you wish. I guess we need to, I tell you what I think is the most important. Let's talk about prevention and behaviors that will help us not to have a stroke. So let's come out of the chute talking about that. And then I know we got Miss Denise Goins on, and she's the resident expert on strokes. Go ahead, Doc.
Well, I wanted to get into the prevention a little bit later. I just wanted to talk a little bit more about stroke epidemiology, meaning
Okay.
like what it looks like around our community. So, stroke is the leading cause of disability in the nation, and Georgia's no exception to that. Means like out of all the medical conditions you could have, the most disabling thing is a stroke. That just wrap your head around that for a second. Think about all the people with cancer, heart attacks, and all this stuff. All those don't are not as bad as causing disability as stroke. So it's the number one cause of disability overall. Also, it's the fifth leading cause of death,
Mm.
and that's in the United States and same states for Georgia as well. Georgia, we have a particular aspect, I would say, because we're right in what they call the stroke belt. The stroke belt being there's more strokes common in Georgia and the southern areas than the rest of the country, actually 30% higher. And
Wow.
we actually barely touch the stroke buckle, which is even higher at 40% higher than the normal nation. And to African Americans, the risk of death is actually 33% higher as well from stroke. So it's a lot. And as we know, as Macon community, we have a large African American population as well. So it's very important that we start to recognize and learn about these strokes and what they can do to you and how to prevent them and how to recognize them, more importantly, when they are occurring.
Well, I agree. Well, I'm glad you began with that because I mean, you kind of had my attention at first, but after giving those statistics, you got my undivided attention. Because of the factors that you mentioned about how prevalent it is in Georgia, how prevalent it is for African Americans, and the kind of geographical, statistical nature of stroke diagnosis and what have you. We all want to live a quality life. And then
Correct.
when the stroke is the most disabling malady, if you please, that one can have, then I'm doubly interested in what causes it and what can I do to prevent it. Kind
I
of
want to
sick.
go back to the whole disability thing. It's not even
Okay.
like not only the person, but it's the family members who have to take care of the person. It's the community resources that have to take care of people. Say the patient has no insurance, it's all the taxpayers' money is going to put them in a home, whatever, say a home or whatever to take care of them. So it affects
Right.
everybody, even though people don't
Right.
think it directly affects them. It does. It still affects everyone. And
Yes,
yes,
it's
it is somewhat preventable. There are certain risk factors that are preventable, such as weight loss. That's a big one. BMI should be 25, around 25. Most people are not that, but that's the average goal. Hypertension is something that's treatable. And a lot of people are walking around with silent hypertension, never got their blood pressure checked. Coasting like in the 180s, 90s, over a 90, which is a higher blood pressure we like. Actually, look for the goal blood pressure for us is 130 over 80. We try to keep it below that. That's our goal number. And there's tons of people walking around with hypertension who just don't want to take the medication for any other reasons, or they say, oh, it's not that high. I don't want to take anything. But that's one of the most preventable risk factors. Another big risk factor is diabetes. Diabetes, not having your sugars controlled, is a big issue. Typically, you want your sugars to stay under 120, which we have a measure of the average blood glucose, which we call hemoglobin A1C. Hemoglobin A1C tells us what your average glucose has been over the last few months, not just like a one-time spot tell. It tells you the average. We want that average to be less than 7. Prediabetes is between 5.5 and 7. Anything under 5.5 is fine. If you're between that 5.5 and 7, that means you're in that pre-diabetic range. It means you're running a little bit high, that we're going to have to start addressing that. After 7, you definitely need something addressed. Another preventable risk factor is elevated cholesterol. Some people have genetic factors that cause their cholesterol just to go up. A lot of times it could be diet, but that is something we could definitely modify. And if your primary care doctor checks your cholesterol, we want the bad cholesterol, which we call the LDL, to be less than 70. Smoking is a huge preventable risk factor, very big risk factor, and that is definitely preventable. Not only does smoking increase your risk for strokes, it increases your risk for all kinds of other things like cardiac disease and peripheral vascular disease as well. That's a very easy modifiable risk factor, yet it's hard for people to do. Um, that includes not only smoking tobacco, but also oral tobacco as well. Any other drugs, illicit drugs, all of them are bad and all of them can put you at risk for a stroke, especially the amphetamines and cocaine. Typically raise your blood pressure to points that are much higher that put you at risk for strokes. Another modifiable risk factor is alcohol. Alcohol, we recommend that the average male drink no more than 2 to 3 servings of alcohol, meaning like a beer or a 5-ounce shot. That's what's equal to a serving of alcohol. Less than that per day. Once you drink over that, that brings your risk significantly higher for stroke. Another big risk factor is sedentary lifestyle. So that is an easy modifiable one that you could just say, hey, I'm not going to sit around all day. I'm just going to take a 10, 15-minute walk. That by itself will help lower your risk for stroke. So these are things that you could do to help modify your risk factors and try to help prevent a stroke down in the future.
Wow. Well, you have enumerated them very much so. Denise, did you want to add anything to that? Did he
Um,
just
one of one of the things that I would like the community's not necessarily aware of is that our hospital does a community needs assessment every 3 years. And we look at those risk factors and we kind of compare them to Georgia and we compare them to the national average. And when Dr. Smith was talking about hypertension, the national average for hypertension is about 40%. The state of Georgia is 37%. Just in the central Georgia area, we came in 2023 at 47%. So
wow.
47% of central Georgians have hypertension. Same thing with the cholesterol. 32% is the national average. Georgia ranks about 32%, but in central Georgia, we're at 38%. And then when he included the diabetes, 12.8% for national and 17% for the middle Georgia area. So those are the three biggies. Of course, we have all of those risk factors that impact each other. If a person has high cholesterol, they're going to have heart disease. If they have high blood pressure, they're probably going to have heart disease. So those are the things that we really have to look at. And I will tell you, out of all of our strokes in 2023, 82% of our population of people that came in with strokes actually had high blood pressure. So 82% of all of our stroke patients in 2023, but we were down to 75% in 2024. So hopefully the word's getting out for people to watch their blood pressure. We do have a hypertension clinic here at our hospital that I'd like to mention, and they can reach out to the hospital to learn more about that hypertension clinic because they can help those patients that may not have a physician right now get established with a physician so that we can treat that high blood pressure, since that is such a big risk factor for stroke.
I hope that this doc, I hope that this is soaking. I really do because we all want to live a quality life. And then I really appreciate Atrium's concern. And then one thing that people need to know is that there are avenues to try to find out, you know, it's better to be safe than sorry. You've done an outstanding job of enumerating all of the factors which absolutely influence people having the likelihood of a person having a stroke, and it's just so devastating. And then and oftentimes people don't get over it. And then you talk about people dying for strokes. I really didn't realize that. I
Yes.
guess it's not advertised a lot, but I very seldom hear that somebody died from a stroke. But obviously, it is a cause of death. So that's another reason why we ought to be extremely concerned about the stroke. So
So,
go ahead.
sorry, when you say people dying of stroke, it was funny when you say that. Really not always actually the true stroke that kills the patient. It's actually the secondary factors like they're losing the ability to be able to swallow and develop a pneumonia or some type of secondary infection. That's usually what is usually cause of death, but it was all started by the stroke, which starts that cascade downhill.
Wow.
And
Wow.
one thing that the general public doesn't know is we have almost 800,000 strokes a year in the United States. A stroke occurs every 40 seconds, and someone dies of a stroke every 3 minutes and 17 seconds. Another little known fact, twice as many women die from stroke than dies from breast cancer. So it's knowing what your risk factors are, adding in that atrial fibrillation, that irregular heartbeat, just knowing all the risk factors that Dr. Smith, touched on, and being able to go and talk to your provider and making sure that you're on the right medication and the right pathway to prevent those strokes, because that's the biggest thing. 80% of our strokes are preventable if people just know what
Wow.
their risk factors are and keep those under control. So Dr.
Wow.
Smith did a great
It,
job
it,
of eliminating those.
and it really goes to having a primary care physician. Having that primary care physician, a lot of people don't like going to the doctor. Me too, but but going to that doctor to make sure that they keep up with your blood pressure, all those routine screening exams is very important. That's the prevention we need. not only just to prevent strokes, but prevent future cancer screening, everything else on top of that.
That is so outstanding and so informative. Now I want to delve into two different things. Uh, I think that there are clinics and there are resources, that people can utilize. We die because of the lack of information, really. So, and I know that oftentimes people shun or don't want to go to the doctor, but there are resources available to at least, I mean, sometimes they are free. They've got clinic, and I know Atrium's position on trying to be holistic and at least providing an avenue for people to get some kind of care, some kind of diagnosis, and some kind of treatment. So, what kind of resources, and doctor, you already mentioned to go to your family physician, but I mean, are there any other programs or clinics or resources where at least a person can at least find out, even if they don't have the resources, insurance or what have you, available at this point? But then the kicker is, go to the doctor. That's the bottom line. We're not telling you that this is going to serve as an alternative, but in the event that this is the case, then what can possibly happen?
So we were talking about prevention mainly, and like we said, it's going to the doctor. We do have one clinic here, which is an Anderson Health Clinic. It's an alternative to those people who don't have another way to see a physician. But also, not with the prevention, you want to know what happens when you do have a stroke. That's what I was going to catacomb into next. And we use a
Okay.
we use this screening tool called B Fast. It used to be just fast, but we had to add the B to it, and that's a new thing. It hasn't always been that way. The B is balance, meaning if you feel like you're off balance, you need to call 911. These are reasons to call 911. So be fast is a reason to call 911, saying that you do have a stroke, so that the appropriate things can be done. Okay. The E is for eye, and that could be eye deviation, meaning like if somebody's eyes are forced to one direction, or the person complains of double vision or losing vision. All those acutely are signs of a stroke. And we added the B and the E to the be fast because we were missing some of the strokes that happen in the back of the brain, and those are some of the symptoms you get from the strokes in the back of the brain. And so that brought awareness to more than just one type of stroke, which is the more anterior type of brain. I know I'm talking science, but I'm trying to give you a perspective of what to look for. The F is one of the easier ones, and that's his face. We look for any kind of facial droop. Okay. A is for arm. So we have them hold their arms up. If one drifts down, or if they say one side is weaker than the other, that is a very good indicator of an acute stroke occurring. S is speech. So speech could be two parts. It could be slurring of the speech or the inability to produce speech. They have different names, but the S is still for speech, and any speech abnormalities that's acute should be considered to be a stroke initially. The last part, most important, is T for time. We have a certain amount of time that we could offer medications to help somebody who's having an acute stroke. The medication we use at Atrium is called TNCase, tenecteplase. It is an IV medication that has to be given within the first 3 hours of symptoms. You heard that right, 3 hours. We have an extended window for some people who can go out to 4.5 hours. Then with certain imaging techniques, we can go further, but a lot of those tests are experimental right now. But the main thing is to know time. And the reason the time is because we could actually do something for those people who are having a stroke. The medication, like I said, we offer is tenecteplase here at Atrium. And we do have agreements with Wellstar, North Fulton, and Grady for the secondary treatment, which is we call embolectomy. So certain people are capable of getting an additional study if they needed to, called a cerebral embolectomy, which they actually go in, or mechanical thrombectomy, in which they actually go in and remove the clot that is causing the stroke. And we have that agreement with Grady. and Wellstar North Fulton to transfer our patients up there immediately via helicopter if available, or via ambulance if their stroke is one of those types of stroke that can have that intervention. And some of those interventions can happen in up to 24 hours. So you do have time, but not much time. So it's it's better to come in earlier than later. And I see it all the time where patients, it's like, hey, my arm went weak. I thought it was just nothing. So I'll just say, I'm gonna go to sleep and I'm gonna wake up and go to the doctor tomorrow. By the time they wake up to go to the doctor tomorrow, the stroke is completed and we can't do anything. So the main thing is for them to recognize the time. As soon as you notice something, don't wait. Don't say it'll go away. You need to head to the hospital immediately. If you come via EMS, it's even faster. So note to the people in society that if you notice these symptoms, you need to call EMS. You don't need to drive to the hospital because you're going to get delayed a little bit longer. EMS makes it immediately happen if you have these symptoms. So use your emergency medical system. They're there for a reason, and this is definitely an emergency, which there could be some intervention which we could help you out.
Well, I hope we understand what he's saying, and I hope we are absorbing the information that's being put here, because I mean we don't want to have one, we don't want to show symptoms of one, but in case you do, if you remember the T, you got to remember the balance and the eyes and the face and all that stuff. Well,
Yes.
you can kind of remember that, but yeah, I mean, hey, if you see any of these factors, or if you're experiencing any of these factors, then what he's telling you, that if in fact it is or maybe a stroke, then within a certain time frame, you could be less worse off if in fact you move expeditiously toward determining what's wrong with you and anything of that nature. Well, what we're going to do, Doc, is so before we leave, Denise and Doc, so just like on your own, if a person just wanted to kind of learn more information about it. Of course, you all have done a phenomenal job, but they can just kind of research it and call somebody or look something up. How can one become more educated? Go
We
ahead.
have a few things. I'm gonna let Denise, our stroke coordinator, go into most of these, but we have our 10-day stroke challenges coming up May 12th. That's one way to get more knowledge. We also have multiple community events and to get the knowledge out to the community of Macon Bibb. But you got to remember, we're not just Macon Bibb. We're all the counties surrounding Macon Bibb because we're one of the few large hospitals that's the primary stroke center that's around. So,
Wow. Denise?
So, as Dr. Smith said, we are having a 10-day stroke awareness challenge. It will be posted on Facebook. The best way to access that is to go to our Facebook page, which is Atrium Health Navicent Neurosciences, and that's plural with an S, Center. That's our Facebook page. It will start May the 12th, and it'll be 10 days worth of education. And plus challenges. One day we will talk about education, what is stroke, what's Stroke Awareness Month. May is Stroke Awareness Month. It was declared several years ago. Part of that challenge, they can go on one day, learn something about stroke prevention. The next day, do something like some exercises. We've got exercises for stroke survivors. Most of these are through the American Heart and American Stroke Association, so they are approved programs. And we ask that they take a little survey at the very beginning to see how much they know about stroke, go through those 10 days and take that same survey at the end to see how much they've learned. So it's an opportunity for them to learn more about stroke. And we also have available, I go into the community, I go into churches and speak, participate in health fairs. So they're welcome to reach out to us here at the hospital as well.
Oh, that is so it's called the 10-day stroke challenge.
Yes, sir.
correct.
And then everybody can participate. And so,
Everybody can participate. Yes,
so
sir.
what
That's
I
just
would
one of
do,
many events. We also do an annual stroke symposium, and Denise does, like she said, she goes in the community often and gives us information.
so
With
let me
every
ask
patient,
let me ask this very quickly. So, Denise, so if in fact somebody is having a forum or a seminar or an activity or what have you, then, under certain circumstances, are you available kind of to go in and be like a stroke educator?
Yes, sir. I just went to a church last week and spoke to their
Right.
senior group, and we
Right.
did like a presentation and a little question and answer. They're welcome to get in touch with me here at the hospital. My direct number is 478-633-1544.
Oh,
And
wow.
I'll make that information available for you so your listeners can have access to that. But we are more than willing to go out into the community and share what the knowledge that we have with our communities.
Yeah, we've got a section on our website, makingblackpages.com, that says news and views. So we will certainly help to promote it because I think it's extremely important to the community. Before I get the man with a lot of titles to give a closing statement here, uh, I just want to say this is a call to action. I'm your host, Alex Habersham, having had a phenomenal topic on a subject that we all need to be familiar with and knowledgeable of because you never know. Stroke ain't no joke. Stroke ain't no joke. And so we don't want to be in the situation wherein we experience the kind of experience that that comedian had that I talked about. Though he was joking, it's no joke. So, it behooves all of us to pay attention to it. And that's Miss Denise going. And you the resident, what's your resident what, Denise?
I'm the stroke program coordinator here at the
Okay.
hospital.
Okay. Site program coordinator at Atrium. And of course, Dr. Matthew Smith, who's deals with neurology. Give us your title again, Doc.
I'm the director of neurology and stroke at Atrium Health, Navicent.
Well, I should have been able to remember that. The director of neurology and stroke at Atrium Health. So this is so important. And you can't begin to imagine how thankful I am, for the three of us to be able to impart position to the community. So hey, take part in that 10-day program. And then if you need to know more about it, just call my office at 478-464-0074, and I will provide more information. This is a call to action. I'm your host, Alex E. Habersham. Stroke ain't no joke. Have a great day.
www.makingblackpages.com